Hello and welcome to our panel. My name is Pauline Vasquez, NXUnite team member at Nexus Marketing and your moderator for today's panel. Today's panel topic is Better Tech, Better Care, Streamlining Healthcare Operations. As usual, before I introduce our panelists and jump into this fascinating topic, I do have some logistics to cover. NXUnite by Nexus Marketing serves as a powerful community resource designed to foster connections and facilitate lasting relationships within the mission-driven sector. On NXUnite, you can find upcoming industry events, suggested influencers to follow, trusted solutions, and cause-driven podcasts. NXUnite also hosts webinars, demos, and panels with experts such as these lovely folks with me today. NXUnite is brought to you by Nexus Marketing, a digital marketing agency specifically dedicated to the mission-driven sector. Our team accelerates organic growth through key digital channels like SEO, AI visibility, HubSpot, branding, and design. Today's 45-minute panel will include time both for questions curated by my team and questions from you all, our lovely audience. At any time during the panel, please feel free to submit your questions via the chat. We will spend the second portion of the panel addressing as many as we can possibly can. Finally, before I introduce today's panelists, I do want to thank you all for attending this panel. We are very excited to be in touch with you, the mission-driven community. Thank you for taking the time to be with us today and to learn from these outstanding experts who I will now finally introduce. First, we have Alicia Sanders, Director of Operations at Bluebin. With over 15 years of experience in hospital supply chain and logistics, Alicia is a trusted leader in driving operational excellence across healthcare systems. She specializes in optimizing processes and ensuring clinical teams have the resources they need to succeed. Alicia is passionate about sharing practical strategies that help healthcare organizations operate more efficiently and improve patient care. Alicia, it's wonderful to have you with us. Next, we are also joined by Dr. Charu Raheja, PhD, a healthcare trailblazer and founder of innovative healthcare solutions. For more than 2 decades, she has worked to improve patient access, empower clinicians, and develop technology-enabled healthcare systems that serve millions of patients. Dr. Charu, thank you so much for being here today.
Thank you.
Finally, we have Reggie Dye, Chief Revenue Officer at EMS. Reggie is an executive with a rare blend of sales and operational talents. He is a systems builder and an effective leader of people who has developed the tools, processes, and metrics required to effectively manage geographically dispersed teams and businesses. He directly led sales teams of up to 55 and over 100 indirectly. Reggie values mentoring and sustainability and believes that sales growth is important, but developing people and building a world-class company are equally so. Reggie, thank you for joining the conversation.
I appreciate the opportunity to participate. Thank you.
All right, now that we have gotten to know our panelists, it's time to get the conversation started. With our first question, what common pain points in the care continuum would benefit the most from tech adoption? Alicia, I'll let you start us off.
The biggest thing that comes to my mind is the communication gap that is often experienced between supply chain and clinical. A lot of automation can prove beneficial in those areas. The first thing that comes to mind in the supply chain realm are tools and things such as dashboards that can ultimately help not only drive key informed decisions what is needed, but it also gives supply chain a tool to communicate with supply chain with what is going on in their realm of supply chain. So that's the first thing I think is just automated systems that can help bridge that gap of communication that is often experienced in supply chain.
Great. And Chadu Raheja here. I hope you don't mind me jumping in, but Alicia, I completely agree with you. I think that one of the biggest points in healthcare right now that we're seeing is the fragmentation of information. It's like patient moves from the home to the primary care to maybe a hospital or pharmacy, but they have to carry that information with them. So at that point, a risk increases because maybe something is missing, and the patients have to keep track of about all the information. And so if we could use technology to improve this visibility, make it easier, access would become easier for patients as well.
All right, thank you, Dr. Cherry, for jumping in on that. Reggie, I'd love to hear your perspective as well.
Sure. So at EMS, Education Management Solutions, our focus has been in healthcare and clinician simulation. We've been at the forefront of that for more than 3 decades. And so I'm speaking from a simulation standpoint and helping caregivers be prepared for delivering care. And I think about some of those pain points in the care continuum that I think could benefit from tech adoption. One comes to mind is errors, caregiver retention, the ability to track competencies in recurring education, tracking privileging, preceptors, new procedures and equipment. And so as you look at that care continuum, I mean, some of the ways that we've been able to help is just really kind of the adoption of technology to replace, to become more efficient, to replace spreadsheets and paper with digital solutions, creating integrated platforms that put together the various different sources that you may have for administrative platforms or clinical platforms, LMSs, bringing those things together into one place, getting rid of the paper, working with a new staff to help them develop competencies faster and be able to shorten their time to practice. So things like that, helping retain staff by helping them practice at the top of their license, and being able to recognize and reward staff based on the competencies and their value to the organization versus just time. So we brought together some of those kind of things in terms of analytics, reporting software to bridge the gap between administrative tasks that take up a lot of time and the technology there, and just addressing some of those pain points, just again around retention, improving errors, et cetera, tracking competencies.
All right, thank you so much to the panelists. We're off to a great start. It's nice to see how technology is something that's helpful across all the facets of the management in healthcare operations, from supply chain to simulation, as well as staff retention and administrative tasks. And with that, I will go ahead with our second question. What are the most effective ways to use these technologies to bridge the gap between, again, administrative tasks and clinical care? Dr. Charu, I'll turn to you first for this one.
Yes, I think that one of the biggest problem in healthcare is really all the administrative burdens. There's so much talk about, AI is going to replace doctors and all that stuff. It's not true. That's not going to help. I think where technology can really help is structuring the information before it reaches the clinician. So that, for example, use AI automation to help collect all the patient symptoms, organize all the patient messages, organize their history, so that it's all in one place before the clinician even gets it. So the way I look at it is that the best technology is not going to get rid of the physician. It's actually going to protect the physician by removing the noise around it. And, it's interesting. I was speaking to a doctor yesterday who said that, he works with patients who had gotten into car accidents. And the doctor was saying that one of the biggest things that takes his time is to get the history of the patient, because it takes so long and it's so much time on his part. So before he can even provide care, he's spending most of the time actually getting all the history and all the information, which a lot of that could be collected ahead of time and save time for the doctor. So I think that's where I really see the improvement in healthcare. I see technology helping healthcare.
Thank you so much, Dr. Charu. Reggie, would you like to add something?
I agree completely. I mean, from our perspective, we want to leverage technology, and I'll talk about artificial intelligence or AI in particular, To free caregivers of those administrative tasks, or at least reduce the amount of time they spend on them, and create efficiencies and let them spend more time in clinical care. So we want to automate tasks where possible. We've introduced AI scoring in some of our simulation training and allowed it to save time for faculty by taking a look in audio and video and making observations, doing assessments, automating some of that manual workflow associated with assessments, and reducing that faculty time so they can either cover more or spend their time doing other things. But it also, at the same time, leaves humans in charge. So AI is not taking over, it's being an assistant. It's just getting rid of some of those administrative tasks and allowing faculty to spend more time training folks clinically so that they're able to produce better outcomes. And also part of that, in reducing the administrative tasks, is just there's some of the reporting and analytics that go along with that, to reducing that education burden by collecting data and providing metrics, performing metrics for leadership, and just being able to do queries in simple, plain English language and get responses in the same way. That allows them to, again, reduce that administrative time gathering data, provide them better analytics, predictive analytics, and also being able to track competencies to see how cohorts or students are progressing along their training. So I agree completely. It's not to replace anyone. It is to assist and just relieve them of some of the burden, some of those administrative tasks that take up so much of their time.
If I just add one thing, and I know, sorry, I'm taking a little time, Alicia, but I just really wanted to bring up that what Reggie just said, because one of the things we did that was so exciting is that we actually created an AI that is interacting with our nurses so that the nurses can train before they even get on a phone call with a patient. And it's really helped increase their confidence. So there's so much we can do that is outside of clinical, but it's helping patients. Alicia, please, I'd love to hear your answer and how you're doing in your area.
Yeah, so one of the big key areas that I can see this helping, to everybody's point, you're never going to have AI do 100% of the work. You still need to have that human interaction. But the first thing that my mind gravitates to is the under the hood tasks that folks just kind of never really get to see. Examples would be bill and replace, right? So a nurse has used something in Epic and now we have to replace it. If we can automate things like that, not only does it give time back to your financial and purchasing department, but it automates a lot of the delay that can sometimes happen when we can't.
Definitely. Thank you so much. I appreciate your thoughts on your take on AI not taking over. Really love that point, but rather just helping lift the administrative burden out of the teams that we have in healthcare. And I am actually going to move forward with the third question here. What would you say is the first step a facility should take if they have a limited budget but want to modernize? Reggie, I'll start with you.
Make sure I was unmuted. Now, from my perspective, I think about people who were building simulation centers, either renovating or building from scratch. And so one of the first steps you should take is really getting some outside help. Engage with someone who can help you get the most cost-effective and easy way to use easy to use solution, and not just focus on selling to your budget. So in other words, working with someone who can help you understand your needs. Do you need high fidelity, low fidelity, mobile solutions? Thinking about the sim center design in terms of the layout. Is it a new build? Is it renovation? What's the intended use? Who are the types of learners that are going to be coming through your center? Thinking about that process workflow, just understanding what the latest technology that's available out there, help you prioritize your wish list, so to speak, to distinguish needs from wants, and also somebody to bounce some feedback off of, bounce your ideas off for feedback to help you design so you can stay within that budget. So it is really just kind of getting some outside assistance, I think, and just getting some different perspectives on what's available out there, because in our world, and a lot of our sim center leaders, they're in their sim center, they're creating the clinicians of tomorrow, but they're not really focused on all those other things that it's walked through that just really help them create a better environment to produce higher performing clinicians.
Thank you, Reggie. Alicia, what are your thoughts?
There are so many different AI tools that are available out there. I usually like to say, hey, let's pause. Let's do a current state map assessment of where we stand today, understand where our gaps are, put in some control processes, and then from there figure out which AI solution best suits our journey and our path that we are trying to take going forward. That's typically, if you can understand what is going on in your wheelhouse and understand where our foundation is, from there we can understand the people that we need to get there, and then ultimately the technology that'll get us across that finish line to drive that ultimate success.
Thank you, Alicia. Dr. Charu, anything to add?
Yeah, I think that, there's so much information coming at us right now that it can get really confusing and overwhelming. I mean, literally has spent weekends just researching and understanding what the different technologies do. So if I would take a step back, I think that the first step is not really buying technology. The first step is looking at your company, map your workflow, identify where the biggest frictions are happening. Because many facilities will start with a tool. They hear about AI, they start automating, they do remote monitoring and all that. But if the process isn't clear, the technology is going to add more noise to it. So figure out things like, especially if you have a limited budget, which was your original question, where's the staff spending more time on repetitive work? In fact, we had a conversation about that with our staff this morning about documenting what is repetitive work so we can start using AI to solve those. Where are patient messages getting delayed? Are they getting confused or lost? And the third thing, where is the risk? Right? One of the things for healthcare organizations is the risk if information is missing or not reaching the right person. For example, if somebody is calling and they have a headache that's a 10 out of 10, well, that message needs to get to a provider immediately. So let's not delay with all the noise and everything else that's out there. Let's get that message to the provider as soon as possible. So we need to really look at it from three standpoints, I would say. What's the repetitive work? Where is patient care getting delayed? And what are the places where risk is the most pronounced?
Definitely. Thank you, panelists. It's very interesting. Completely agree that the first step is always coming in from within the team, identifying gaps or friction points, knowing what you need before actually outsourcing any tools that might be helpful to improve your operations. All right. This is one of the last questions I'm going to ask before opening up to our wonderful audience. So this would be a great time to get those questions in so we can try to address as many as possible. How can organizations adopt cutting edge AI or automation without compromising HIPAA or data integrity? I'll go ahead and hand this over to Alicia.
Yeah, so I really think it comes down to ensuring that what you are using is tried and tested, right? Again, as we had mentioned, there are a lot of options that are out there, right? We just want to make sure that we are picking the right one. And then as far as the other piece of it, right, we want to make sure governance before innovation is taking place, right? So HIPAA compliant infrastructures, as I mentioned, are vital. And we also want to make sure that we're limiting that data exposure. Again, we want to make sure that all patient information is protected. And then, as we have always been talking about AI and keeping a human in the loop, we absolutely need to make sure that is never compromised, because at the end of the day, we want to make sure that not only is AI helping us, but our patient data is still protected.
All right. Thank you so much, Alicia. Dr. Charu, how do you see this?
Sorry, just unmuting myself here. I think this is such an important question because healthcare staff are exhausted. In fact, we constantly listen that there is burnout among healthcare staff. We've been hearing for the last 6 years since COVID, even more so. And I think that they often resist because they're worried about more work. In fact, I'm actually writing a series of articles in a newsletter in LinkedIn about that. Please follow me, because tomorrow I'm going to drop an article about physician burnout and what can be done about it. And so I think, and related to that, it's the main thing is to avoid introducing technology as something more for people to do. You want to introduce this as a solution to a pain point that the staff is already feeling. Like, leaders need to start listening. You can't just go in and do a blanket statement, I'm applying this. We can't do that. You've got to ask nurses, pharmacists, frontline staff, what slows you down? What do you have to repeatedly do every day? Where are patients getting frustrated? Where do you wish the system did for you? Right? So you want to be really careful and be very clear about what the technology is going to do and help them in their plate. Because I think that you don't want people to go like, here's one more platform, now I have more work for me. Instead, I almost like, I've been thinking about this even in our own company, and I kind of present AI like, this is a helper. This is like your friend, your assistant that now you get. And so instead of sitting there and copying one thing to the other on a spreadsheet, guess what? You get to just see the results and analyze it and focus on them. Hey, maybe take an extra second to actually stretch during the day, which are also very important for productivity and everything else. So I'd say you've got to involve staff early. You've got to be very clear about what technology removes, and then frame technology really as a support. And I think if we do that, people will be excited as opposed to all the other issues that we're hearing.
Thank you so much, Dr. Chair. Reggie, what are your thoughts?
Yeah, I think there are two pieces here. One is the adoption side, and one is the technical side. From the adoption side, one of my old mentors always said, you got to start with the why. You got to explain to people, why are we doing this? What's the benefit? What's the return on investment? How are we going to be replacing or consolidating other systems? And going back to the question about more, is this going to be more work? And the point Dr. Charlie made. And then on the change management techniques that go along with implementing a new system. So that's some of the adoption piece. But on the technical piece, I think about the HIPAA, data integrity. I mean, we're in a situation where we don't deal with patient information in our world. We're dealing with students, but there's still FERPA requirements and laws that govern some of what we do. But our solutions have all the necessary accreditations for data security, like SOC 2 compliant. For those of you in Texas, Tex ramp certifications. Everything's based on authorization, so learners are prevented from seeing others' information. And just so some of those kind of safeguards, I think, are important from a data integrity standpoint. And going back to the point Dr. Chadu made, we're using AI, and we encourage others, for time savings and for analytics. I talked about the AI scoring to save time and reduce workflow. So our focus is really on adopting cutting edge AI for time savings, analytics, reducing the administrative burden that a lot of educators and clinicians are faced with here today. So again, just the how to adopt it and implement it, as well as the data integrity or technical side of it, I think are both important here.
Thank you so much for raising those important and interesting thoughts, everyone. Okay, now is the moment I'm sure many of you were waiting for, our Q&A portion. Reminder, you can still continue to send in questions through the chat. As we go through these questions, we will work on answering as many as we can. Now, starting off with... Yes, Dr.
Before we start, I would love to follow up what Reggie just talked about, because I think that's such an important question. One thing that I like to talk when I'm speaking about healthcare, I actually came from economics, finance, actually. So I think very differently than a lot of healthcare people do, but more because I'm looking at other industries. And what is interesting to me is that, let's say we're talking about an industry or company that is delivering, maybe food delivery. If it fails, well, we didn't get food. Maybe we're hungry. Maybe we have to go to a restaurant instead. However, that's not that casual in healthcare, right? Healthcare, we're talking about people's life. We're talking about protected health information. We're talking about clinical decisions, and we're talking about trust. So I think in healthcare is especially important. I think HIPAA needs to be taken into account, SOC 2, all of the things that we make sure data doesn't get out there, and also data is not corrupted. So anyways, I just really wanted to point out, just follow up in what Reggie said, because I thought that was a really great point. Thank you.
Definitely. Thank you so much, Dr. Chair, for adding to that conversation. Now, on to our questions from registration. I think this is something that's already been touched on and would be a great follow up to what we just talked about. Again, this came from registration. The question is there such a thing as too much automation? Where must we absolutely keep a human in the loop to ensure patient safety? I will go ahead and hand this over first to Alicia.
That's a little question. Yes and no. I would say you absolutely need, in the realm that I come from, absolutely dashboard, your leadership standard work. There are some things that you still need the human interaction on. One of the big things that we cater are daily huddles, right? Supply chain and clinical, we're me to see. Let's talk about our census, talk about, what is flowing, and let's have these key informed decisions. Those are some things that you're still going to have human interaction. However, on the data analytics side, you have those dashboards that can have those predictability trends so that you can make those key informed decisions before you risk things such as stockouts or back orders. The other piece that humans are still going to be involved in, to Reggie's point, we had talked about clinical scorecards, right? How are we functioning? Are we 90% or are we 100%? If we ever find that we fall below our threshold, we need a human to fix us to get back to where we need to be, right? So there's always going to be that relationship. There isn't going to be a complete takeover, as they like to say.
Thank you so much, Alicia. Dr. Cherry, anything to add there on?
Well,
Yeah.
I think that's what Alicia is saying, and that's what we've been talking about. I look at AI as a second set of eyes, maybe something to help us move faster, more efficiently, but it's not the final decision. So AI can help all the way to helping get all the history, even suggesting things that the clinician should look at. However, the final decision has to be the clinician. So I see AI as a very positive thing, because more and more doctors and nurses and clinicians are spending time doing work and getting overwhelmed on things that are just paperwork, just moving things from one place to the other. And AI can solve all that. AI can also help give advice, give suggestions, but the final decision has to be human. And I think that's how we win.
Thank you so much, Reggie.
No, I agree completely. The human factor is indeed critical. Yeah, I think about in our world, in the clients that we serve, you've got clinicians, doctors, nurses who are going for their credentials, and I want to avoid a commercial here, but just thinking about keeping the human involved in the assessments. I mean, we've got the ability to say, hey, if Dr. Reggie comes in and is interacting with a patient or a mannequin, did I wash my hands? Did I introduce myself? Did I ask certain questions? AI will pick all that up and it'll say that yes, he did this at 2 minutes and 30 seconds into the video, and you can click here and see where that is. But we still line up the human assessment, the human faculty's assessment of my performance along with AI, so you can see where there's agreements and disagreements. But the human faculty has the ability to say, I don't care what AI says. This is what happened. This is what I saw, etc. So they can override AI's decision, because we don't want someone who's going on their way to becoming a doctor or nurse to contest a grade because AI said I didn't do something or I did do something. So it's very critical to keep that human human aspect and human oversight of the use of artificial intelligence. And I guess the first part of the question was, is there such thing as too much automation? For me, no. I mean, if you can make things easy, automate things, make it simple, free up time to be able to devote to other more important things where your skill set or your knowledge is more important or to apply to, as long as we're applying it in the right way and understanding, in the use of AI, that humans have to override, have the ability to override or do cross checks. I think that's what's most important.
Reggie, can I follow up on that? Because
Yes.
I think about too much automation, especially because I've got adult kids. I've got a 27-year-old, actually she's 28, a 20-year-old and a 24-year-old. So, they argue a lot with parents. And it's interesting because I've had these conversations with them, and they are mad at AI. And part of their madness or their upsetness is because they're feeling that AI is replacing the human. So imagine the extreme where you have an AI doctor. Or, and we think of this as, that's never going to happen, but it's actually not true. I see people producing products that literally replaces the doctor and says, we're just going to have AI all the way and tell the patient what to do. I think that that's where I would say, at least that's how I feel, that's where automation becomes too much, because we almost lose that human component. In fact, we were talking about that recently in our company and saying, well, a robot's not going to make us feel better. It's not going to give us a hug, or even make us, even if it's over Zoom, feel the empathy or crying that you're hurt. So anyways, those are my 2 cents. I know if you have follow up on that, or Alicia's got
Well,
something.
I'll tell you, I would agree with that. When I
Uh-huh.
talk about automation, I'm thinking in terms of workflow,
Mhm.
from that perspective. But what you just described, I agree completely with. I would never go to a AI doctor. In Phoenix, we have a lot of these automated Waymo cars that are driving around doing taxis, driverless taxi. I'm not getting in one of those because I don't trust. I don't trust that. So yes, I would agree. In that sense, there is a limit to automation. I was thinking in terms of workflow improvement and efficiency, but yeah, I'm not getting into a driverless car. I'm not going to a fake doctor.
The cars are fun.
I was going to say,
You should try it.
I plan to live to at least 120, because I think technology is going to be incredible. There's all these things I'm learning about longevity. And hey, when I'm old, I would love to have a chauffeur drive me around. So maybe I would be willing to do that.
All right, thank you very much. And it's interesting to see all the perspectives from different fields get together in just the thoughts about automation and all that. So thank you so much for sharing your thoughts there, Alicia, Reggie, and Dr. Charu. I'm moving forward to another question that came from registration. Now, you may discuss this based on your industry. I think this is going to be very industry specific. So, the healthcare tech market is flooded with solutions promising to fix everything. What would you say is your non negotiable feature in considering a vendor to ensure their tech actually delivers better care rather than just a better sales pitch? I'll go ahead and start this off with Dr. Charu.
That's such a great question. And I think that number one, you've got to go back to your workflow. Look at how your processes operate. And does this technology actually fit? Because it's so tempting. Everything just looks great. First of all. Second, I think take some time to really first analyze how it works. Look at some data of what they've done in other companies and how well it worked. And then I think you need to work very closely with the vendor to make sure it fits in your processes and how your company operates. Because otherwise, it just becomes a mishmash of a lot of things and nothing makes sense. I think that more technology just makes a confusing system more confusing. Just imagine if you already don't have your processes straight. Now you add all different layers of technology, the whole thing is just going to become a mess. And it's sort of like when the internet fuss started. If for those of you who are old enough to remember the late 90s, when the internet, well, actually was 94, 95, was starting, right? Everybody was jumping in and saying, yeah, we're going to start this company and that company, but not everything made sense. And that's why everything fell apart around 98, 99 and all that stuff. And then we had the big crash of 2001. And so I think that is the same thing here. Don't jump in on the first thing you see. You've got to figure out the processes, make sure it makes sense, and then implement.
Thank you so much, Dr. Charu. Reggie, anything to add there?
Yeah, that was great. I really can't add anything to that. I think the one thing I'll just reemphasize is the point about kind of a proof of concept. Not just taking the client or the vendor's word for it, but where have they done this before? What kind of results have they demonstrated? Can I talk to somebody who has used their solution effectively, and to what end? So that's only the point I would emphasize. Otherwise, I agree completely.
I would add, does the vendor take into account the voice of the customer, right? Because ultimately, in the realm that I come from, the voice of the customer is always the clinical staff members. And the last thing clinical wants to hear is, hey, there's a vendor coming in telling me what to do, right? So a lot of that, what the vendor should be focusing on is, again, the workflows, the current state, and then the voice of the customer, what's working, what needs to be improved. And if the vendors are hitting those check marks, they're, we should be moving forward, because at the end of the day, at least in supply chain realm, we're trying to get nurses what they need so they can do best. And who better to tell us what is working and what isn't than the people on the front line performing the work.
All right, thank you so much, panelists, for joining the conversation. We are getting to our last few minutes of questions with this amazing group. If we don't get to your question, or if you have questions specific to your organization, we want to make sure that you get connected with the relevant team to answer them. We have just sent a quick survey to you in the chat where you can indicate which panelists you particularly want to hear from after the session, as well as provide any feedback on this wonderful panel. I'll share your interest with the relevant panelists after this session. All right, with that, we are going to wrap up this portion of the panel so we can stick to our schedule. I've had such a wonderful time hearing from our panelists today, and so I am hoping to get one final piece of insight from them all. Our final question for this session is, how do you think the role of a practitioner, nurse, or pharmacist change over the next 5 years because of automation? And please do let us know and our audience know where they can find you and your organization. I'll go ahead and start this off with Reggie.
Sure. Reggie Dye can be found at reggie.dye at EMS-works, WORKS.com. How will the role of nurses or pharmacists change? I think, I'm not a clinician, but I just, based on my own perception and some of the feedback I've gotten, discussions I've had, I think nursing roles will become more technology-enabled, data-informed, patient-centric. Automation is going to be used to provide greater efficiency and consistency and quality of care. And as we talked about, rather than replacing nurses or clinicians, automation, AI in particular, will be an enabler for them so they can focus on the things they do best, and that is the clinical care. And I'm just thinking about some of those things we talked about earlier, some of those pain points, and just being able to address patient safety and be able to improve onboarding through some of the use of this automation over the next several years, being able to focus on certain skill sets that a new nurse needs to focus on to become practice ready, rather than taking her through a standard onboarding program that may take 8 weeks. Instead, you can do it in 5 weeks and just focus on the needs based on the competencies that he or she has. So just things like that come to mind. But whatever changes occur, simulation in practice and getting ready is going to be, I think, at the heart of those changes. And so that's where we stand, is just helping create those better clinicians, face new challenges that they're going to be faced with over the next several years.
Thank you so much, Reggie. Alicia, how about you?
Yep. So Alicia Sanders, and my email is asanders@capsahealthcare.com. In regard to supply chain and where I see AI really benefiting our clinical staff, the first thing that comes to mind is smart dispensing for our pharmacists, right? Patient needs a prescription refilled. We scan a barcode, patient chart comes up. I see a lot of the pharmacy AI innovations coming forward. And then as far as clinical staff are concerned, we talked about AI tool that would help with charting and things like that. But in the supply chain world, you'd be surprised how many clinical staff members are still heavily involved in supply chain replenishment. In the next 5 years, I would love to see those supply chain initiatives automate, therefore giving clinical time back to the nurse so that they can do patient care 100% of the time. A lot of those automations I fully see benefiting clinical staff. And then as far as supply chain is concerned, we hear, a lot of these new ERP initiatives coming out, Workday, right, Oracle. A lot of these have those automated tools that can help supply chain make those key informed decisions. So no more manual order, right? Scan a bar in the order. So there are a lot of neat innovations that are coming out that I definitely see can be beneficial to all of those three realms in healthcare.
Thank you so much, Alicia. Dr. Charu, what are your final thoughts?
Yeah, so I'm Dr. Charu, Charu, Raheja, at triagelogic.com. If you just look up our company, Triage, like what we do in healthcare, triagelogic.com, you'll find me. And I also have a newsletter in LinkedIn, so you can also follow me on LinkedIn. You can follow the newsletter. It's all about technology, healthcare, and how to improve efficiency. But I think for me, the promise of technology in healthcare is not really about replacing people. And that's what we've been talking about. It's about helping people. Patients, nurses, pharmacists, physicians, and caregivers make better decisions with less confusion. In fact, we implemented a product in one of our hospitals clients, and then another client heard about it, talked to them, and literally called us and says, "We want what they have." Which then people start joking, well, it sounds like a Harry Met Sally phrase, which is really funny. But that's what it is, right? Once people see that their work is getting better, efficiency is getting better, that's when technology and people win. So I think the best technology gives people clarity at the exact moment when they need it the most. So I think the future of healthcare is not fewer humans in healthcare. I think it is better supported humans.
Thank you so much, Dr. Charu, and thank you so much to our panelists. Such powerful words to end our session. And with that, we have reached the end of our panel. I want to give a huge thank you to our panelists for sharing their insights and expertise today. I also want to thank everyone who attended today's panel. And to those who are watching this on demand, thank you so much for watching us on demand. I hope you enjoyed yourself and learned something that will benefit the work that you do on a daily basis. Again, this session is brought to you by NXUnite, an initiative of Nexus Marketing. As the top global agency for B2B marketing to mission driven sectors, Nexus specializes in helping businesses become the default answer for buyers in the nonprofit, association, education, and healthcare spaces. Whether you need support in SEO, AI visibility, HubSpot, or branding and design, the Nexus team has the subject matter expertise to support your digital strategy. You can find us at nexusmarketing.com and through our socials, which we've linked in the chat. We have a packed few months of panels ahead of us, and I hope you will join us for them. Keep an eye on the NXUnite community platform or the NXUnite LinkedIn page to make sure you don't miss out on any of these. Better yet, go sign up now. It takes one click to RSVP once you are logged in. It has been a pleasure speaking with you all. Have a great day. Thank you, and bye-bye.
Thank you. Thank you. It's been a pleasure. Thank you. Okay, I think we're done. Alicia, nice to meet you.